Stephanie tells me I have to hurry up because she's got a question for Monsieur Lowe. A number of years at CFP, this debate comes up, not surprisingly, and then Secretary Chertoff made the assertion, if I can paraphrase, well, privacy, it's all right to give us all the data because we're the good guys. Which speaks to a similar situation with electronic health records, which is a sense of entitlement. The national security establishment and a substantial portion of the medical, especially medical informatics establishment, feel they have an entitlement to all of that data. And then the architecture, to Ross's point, is then built around that entitlement, leading to these 800,000 people having access to 5 million records. So for activists and those that are concerned with individual control, how do you address that question of entitlement? And Ross, I guess to you, if you choose to answer, how does addressing that entitlement get reflected in architecture?
I would greatly prefer it if provider systems remain provider specific. And there is a further reason for doing this, which is that medical record systems, whether for general practice or for hospitals, tend to work if doctors buy them and tend to not work if civil servants buy them. Because the vendor optimizes the system for what the man with the checkbook wants. If the man with a checkbook is a doctor and wants medical records to be available when they're needed, that's what happens. If the man with the checkbook is perceived to want all the data to be hoovered up to the central government, then that's what happens. So there are interesting interactions here between privacy, dependability, functionality, control, and skill. If you do have some parts of the system that end up having enormous scale, then you have to watch them very carefully, such as central registries. For example, one of the test cases brought by the UK equivalent of Deborah's organisation concerns a lady who had her arm broken by an estranged husband who assaulted her after he tracked her down via a hospital system. The assailant's aunt worked as a clerk in a completely different hospital. And so if you give all the names and addresses of all the patients in your country to every receptionist in every hospital, there are consequences. What's important is to have people around at the planning and architecture stage who can foresee this sort of thing and can say, now wait a minute, you've got to give opt-outs here, you've got to have controls there. But if you let the things be designed away in private without the necessary interaction, without, I would suggest, public review of what's going on, then you risk these hazards.
Okay, over here. Thank you.
Thank you. Kasia Szymilewicz, Panopticon Foundation, Poland. Talking about database state, Poland is just about to create 2 huge databases and repeat the same mistakes we've been discussing here. One is for medical health records, the other one is for educational purposes. We've been fighting against this legislation for many months, but with no result. So I'm a bit frustrated. I would like to learn something from your experience. I understand that there has been this debate in both UK and the US. And I see a very easy alternative. In order not to create a central database, we can go for a data decentralization and store medical records, for example, with the patients. And I understand that a system like this is functioning in Germany. So I wonder whether you've been through this debate here, and what was the main argument of the state or politicians in order to create central database? What is this? Is this data mining openly put on the table, or there is any other argument that that brings us to this central model instead of the decentralized one?
Patient-held records have drawbacks. They're used in some applications, such as in pregnancy in the UK and in significant areas in Africa. I strongly favour provider-held records because that aligns the doctor's interest in professional autonomy and the healthcare organisation's commercial interests with the patient's privacy interests. The push for centralisation comes from the usual Leviathan aspects of government. It's driven by administrative convenience, it's driven by administrators' wish for great knowledge and great control, and of course the system vendors play up to this. So the dynamic that you have to tackle is the political and administrative dynamic, and in a country with more decentralised healthcare like the Netherlands, you should be able to find some place that work, I would hope. Our experience with the Database State Report is that we got many of its proposals adopted as policy by our Conservative and Liberal parties who were then in opposition. Now they're in government, they decided to abolish some of the offensive systems, particularly systems relating to children. However, they were not able to or willing to make any dent in our healthcare bureaucracy. Fortunately, perhaps for us, the latest project to centralise all medical records is ending in technical and administrative failure, and they'll have to go back to the drawing board. So another thing that you should emphasise is the fact that large system projects tend not to work, especially when they're done for conflicted motives by large public sector organisations.
Thank you.
I think can I just add one thing to that? Part of the problem that's manifesting itself here is the fact, I think, that we have really lousy privacy risk models such as they are. To the extent we use anything, we use fair information practices or fair information practice principles, depending on who you talk to. And, you know, I am a big admirer of FIPS, but they're relative, they're very process-oriented, they're very non-normative, and we really don't have a good framework beyond that for talking about privacy risks and threats and harms. And a more sophisticated discussion in that vein, sort of supported by that kind of framework, would hopefully highlight some of these architectural issues better.
Okay. I think we have time for just 2 more questions, and if you can be brief, it's only because I'm under strict orders to wrap up on time. Thank you.
Thanks. Stephanie Perrin, University of Toronto. Ma question, c'est pour Monsieur Lowe. J'ai apprécié vos remarques énormément. C'est vraiment une tâche assez difficile de coordonner toutes les compagnies de télécommunications. Est-ce que vous avez une stratégie pour le pluriel? J'ai noté que Nigeria est une partie de cette groupe. Et il y a beaucoup de pluriels ici qui viennent de Nigeria. Et ça, c'est une tâche assez difficile, juste ça, d'arrêter ça et la corruption. Basically, my question is, do you have a particular strategy for stopping spam in trying to harness those telecommunications companies that are working together in West Africa?
Merci beaucoup.
Thank you very much.
Effectivement, comme je le disais dans ma présentation,
In fact, as I was saying in my presentation,
la cybercriminalité au Sénégal
cybercrime in Senegal
concerne plus les victimes, je parle des victimes, concerne plus les étrangers
speaking of the victims, has more to do with foreigners
qui sont dans d'autres continents,
who are upon our continent,
plutôt que les Sénégalais eux-mêmes.
rather than Senegalese people themselves.
Effectivement,
In fact,
les attaques envers ces victimes viennent de chez nous.
the attacks viennent de chez
Viennent du Sénégal et des autres pays de
the attacks coming from Senegal and other countries surrounding it.
Parce que tous les pluriels dont vous parlez, les spams dont vous parlez,
All the spam you talk about
sont envoyés à partir de chez nous.
are sent from our country.
Donc,
So,
parce que dans nos rues, dans chaque rue, il y a deux ou trois cybercafés
in every street there are 2 or 3 cyber cafes
envahis par des gens qui sont là du matin au soir à envoyer des spams à travers le monde.
and people sit in those cafes and from the morning till the evening send spam around the world.
Il nous arrive
So, as it turns out,
d'avoir 1 ou 2 victimes par jour.
we get 1 or 2 victims per day.
Donc, ça montre que la cybercriminalité est mondiale.
That shows that cybercrime is worldwide.
Merci.
Thank you.
Yes, our last question.
Ross mentioned the risk of cloud-based storage for access to sensitive data by the service providers themselves. Some service providers say they want access to information in order to prevent things like hosting of child porn. So what is your position on these service providers forcing people to store their data unencrypted in order to prevent that kind of crime?
Well, I know my quick thought is that this is a familiar debate, but let's get some response from the panel.
Yeah, I think encryption is an interesting issue, but I think actually that one of the things that I've noticed is that yes, of course, law enforcement is extremely frustrated by encryption when it deals with criminal acts like child pornography. It's a very distressing social problem. But there's also tremendously valuable uses for encryption to prevent these kinds of criminal crimes and attacks. So I guess I would say that I've seen, I believe, a somewhat of a shift towards a more balanced view that encryption certainly poses issues for law enforcement. The FBI is concerned about going dark, but there's also, I think, an appreciation for the fact that encryption may be a valuable tool to protect the sensitivity of data from attackers from overseas and other criminal actors.
Well, I think it's even more pronounced than that, potentially, to the extent that, to bring this back around to the advanced cyber threat, to the extent that really is a genuine threat, we may be approaching the point where we need to start making some hard decisions about whether we're willing to take measures like more or less ubiquitous strong encryption in order to thwart some of those attacks, and at the same and as part of the cost of that, give up some of the access which law enforcement enjoys. It may ultimately come down to a very decisive trade-off decision.
All right. That was essentially the finding of the National Academy of Sciences report in 1996, the crisis report, which said that on balance it made more sense to support the deployment of encryption than not.